An autopsy report shows the death of Friends actor Matthew Perry was because of effects of ketamine. His death was ruled an accident.
So the new report is raising some questions about the drug. Our 9 News health expert, Dr. Kohli, is here to help. So Dr. Kohli, let's break it down right now. What exactly is ketamine?
So ketamine is a general anesthetic. We've been using it since the 1970s, and more recently the FDA has actually started approving it for really resistant depression.
Yeah.
And what it does is it gives your brain sort of this out-of-body experience. It's not supposed to suppress your breathing or your heart rate, and that's why it's generally used what we call in the field. The paramedics use it. We use it in, on the battlegrounds in the military because it's pretty safe for most people. But a high level of ketamine can obviously cause problems with our breathing as well. But because it gives you this out-of-body experience, it causes hallucinations. People can actually get agitated when they take ketamine. And if you've ever seen their eyes, they can actually start to go in different directions. We call them ketamine eyes. That's kind of how significant it can be. So a general anesthetic, but used more recently in depression as well.
Yeah, actually can be used in really good ways when it is under medical care. I know my mom has actually gotten ketamine infusion, so it can be really good. You're going to talk a little bit more about that in a moment, but was Matthew Perry supposed to be taking ketamine?
So he was on medical ketamine, just as you said, for psychiatric indications, but the last time he was supposed to have gotten it, which is always done under supervision, was actually a week before his death. And ketamine has a half-life of 3 to 4 hours. That means in a day or two, it's completely out of your system. So there's no way the ketamine that was found in his body was actually the one that he got the week before. In fact, the levels that were found in his body, they said, were at the levels of general anesthesia. So to the point where you can imagine, and as the autopsy report sort of spelled it out, that he maybe was so deep under the influence of the ketamine that he could have slipped into the hot tub, drowned, and not even sort of wake up as he was drowning. And it was also found that he has coronary artery disease, which is not uncommon for men his age, and these are blockages. So now you're talking about less oxygen, you're talking about more stress on the heart, you're talking about probably a little bit of agitation potentially, and then obviously drowning as well could have exacerbated all of those problems.
Yeah, all those combinations. Kind of explain to me what ketamine therapy is. Break that down for us.
So ketamine therapy or ketamine microdosing is using small doses of ketamine to treat patients who have psychiatric problems, usually depression, PTSD, and anxiety. But more recently, they've also been studying it for drug addictions. And now Matthew Perry, we know, was on buprenorphine as well, which is another medicine for drug addictions. And if you use it in small doses, it kind of almost hits reset on your brain's electrical circuit, and that's the theory. But this type of a thing, in my mind, actually raises a little bit of an alarm because the FDA has warned us about compounding pharmacies giving out ketamine, because a lot of people can get ketamine or vitamin K, as it's called on the streets, for recreational use, or can get it from compounding pharmacies. And then if you start giving it to patients who have psychiatric illness, who have a problem with addiction, we know that ketamine can be addicting as well. So you could actually be setting up that person for a different type of an addiction to get these types of off-label uses of ketamine. And possibly that's what happened to Matthew Perry.
A lot of us here in Colorado, we've heard ketamine with, we know that's what Elijah McClain died from, and that's been an ongoing trial we're all pretty dialed into. How did it contribute there with Elijah?
It's unclear. The dose that he got was sort of not an overdose of ketamine, but it's possible that it could have caused him some agitation, just like we talk about, or some hallucinations, because he did say, I can't breathe, and then he was put in that chokehold as well. So if you're requiring kind of, you're hyperventilating, breathing more, your heart rate's a little faster, you're a little bit agitated, possibly due to the hallucinations, and then somebody's got a chokehold on you, it can certainly contribute to worsening of that problem. So the coroner for Elijah McClain has not definitively said that ketamine did not contribute, but he also says it's possible that he could have had some sort of a adverse reaction to the ketamine, that he didn't respond normally to it. We know he had marijuana in his system, and anytime you mix it with some other drugs, that can potentially make the hallucinogenic effects a little bit worse.
Yeah, Dr. Kohli, thank you so much for joining us today.